What is the difference between hair transplantation and prosthetic hair? Which one is the most preferred? Hair transplantation and prosthetic hair are two different approaches to address hair loss, with different advantages and drawbacks. Hair transplantation involves the surgical transplantation of hair follicles from a donor area, usually the back of the scalp, to the balding or thinning areas of the scalp. The transplanted hair follicles are typically resistant to hair loss, so they continue to grow hair in the new location. Hair transplantation is a long-term solution to hair loss and can produce natural-looking results. However, it is a surgical procedure that requires some recovery time, and not everyone is a good candidate for it. Prosthetic hair, on the other hand, refers to non-surgical hair replacement methods that involve the use of hair systems or wigs. Prosthetic hair can be made from synthetic or natural hair and can be attached to the scalp with adhesives or clips. Prosthetic hair can provide an immediate solution to hair loss without surgery and can be a good option for people who are not good candidates for hair transplantation or who prefer a non-surgical approach. However, prosthetic hair can require regular maintenance and replacement, and it may not always look as natural as transplanted hair. As for which option is most preferred, it ultimately depends on individual preferences and circumstances. Hair transplantation may be preferred by those who want a long-term, natural-looking solution to hair loss, while prosthetic hair may be preferred by those who want a quick and non-surgical solution or who are not good candidates for hair transplantation. It's important to discuss the pros and cons of each option with a qualified hair restoration specialist to determine which approach is best suited to your needs. Hair transplant. Hair transplant is a surgical procedure that involves moving hair follicles from one part of the body, usually the back of the scalp, to another part where there is thinning or baldness. The procedure is typically performed under local anesthesia and can take several hours to complete, depending on the number of follicles being transplanted. There are two main techniques used for hair transplantation: follicular unit transplantation (FUT) and follicular unit extraction (FU). FUT involves removing a strip of scalp from the donor area and dissecting it into individual hair follicles for transplantation, while FU involves extracting individual hair follicles directly from the donor area using a tiny punch-like tool. After the procedure, patients may experience some mild discomfort, swelling, and redness in the transplanted area, but this typically resolves within a few days. It can take several months for the transplanted hair to start growing, and patients may require multiple sessions to achieve their desire. Hair transplant is generally considered a safe and effective procedure for treating hair loss, but like any surgery, it carries some risks, including infection, bleeding, scarring, and a suboptimal outcome. It's important to consult with a qualified and experienced surgeon to determine if hair transplant is the right option for you and to discuss the potential risks and benefits. What aesthetic operations can be performed for the middle-aged and older face? There are various aesthetic operations that can be performed for the middle-aged and older face to rejuvenate its appearance. Some of the common procedures include facelift. A facelift is a surgical procedure that helps to tighten the skin and muscles of the face and neck, remove excess fat, and create a more youthful appearance. This procedure is ideal for those who have sagging skin and deep wrinkles. Brow lift. A brow lift, also known as a forehead lift, helps to reduce the appearance of wrinkles and sagging skin on the forehead and eyebrows. This procedure can also improve the appearance of frown lines between the eyebrows. Eyelid surgery. Eyelid surgery, also known as blepharoplasty, is a procedure that removes excess skin and fat from the upper and/or lower eyelids. This procedure can help to reduce the appearance of bags under the eyes and improve vision that is obstructed by droopy eyelids. Neck lift. A neck lift helps to tighten the skin and muscles of the neck, reduce excess fat, and eliminate the appearance of sagging skin or a double chin. Dermal fillers. Dermal fillers are injectable substances that help to fill in wrinkles and lines, plump up the lips, and add volume to the face. This procedure is minimally invasive and can be done in a short period of time. Laser resurfacing. Laser resurfacing is a non-surgical procedure that uses a laser to remove the top layer of damaged skin, revealing smoother, healthier skin underneath. This procedure can help to reduce the appearance of fine lines, wrinkles, and age spots. It is important to consult with a qualified plastic surgeon to determine which procedure is most appropriate for your individual needs and goals.